1972, I reviewed 250 patients who had failed conventional surgical approaches on their back. The average had had 5 to 7 unsuccessful back operations. When I got back to 5 to 7, the record was 52, by the way. And I didn't know whether the patient or the surgeons were crazier for doing that kind of nonsense. I found not more than 80% had never had a ruptured disc. They had been operated because the patient had pain and the doctor was frustrated and didn't know what to do. The most common at that time operation in the United States, that was before coronary bypass became so popular, the most common operation, 80% of the time, should never have been done. I went on a sort of a campaign to say, you know, there's a place for surgery. If you've got appendicitis, you need to have it taken out.
True.
There's a place for drugs. If you've got bacterial meningitis, you need antibiotics. You'll die if you don't get them, probably. But I came to the conclusion that approximately 80 to 85% of the time, people have illnesses that not only cannot be cured by drugs or surgery, but are likely to be made worse. And I started off seeing about 400 patients a year who had failed everything that conventional medicine had to offer. My average patient, 5 to 7 unsuccessful operations. But within a year, I realized they had 49 symptoms average, some of them a lot more than that. Mm-hmm. They had 5 illnesses, not just back pain that had failed surgery. They had high blood pressure, and they had gallbladder disease, and they had, you know, lots of other things. And I suddenly realized I'm not taking care of pain, I'm taking care of stress.
So it's not drugs and surgery, but stress that you need to manage.
Exactly. And basically, all illness is stress. The vast majority of my patients had an unhappy childhood, an unhappy marriage, and or an unhappy job. Let me give you just one example.
Sure.
There's a man who worked for the railroad, had some kind of injury, several unsuccessful back operations, you know, pain, 90% as bad as pain can be, he said, functioning at 10% of his original capacity, taking lots of drugs, etc. We worked with him for 2 weeks. During that time, he realized that he didn't hate his job, he hated his wife. His marriage sucked.
There you go.
By the end of 2 weeks, his MMPI was normal. His pain was virtually gone. He went home, divorced his wife, and went back to work. Literally free of pain. It has to do with those aspects of life that are buried in the subconscious, and it has to do with social priorities and social pressures. You know, it's hard to say I don't like myself.
It would be.
It's very difficult to say my parents abused me. It's difficult to say I never felt loved. People have trouble saying things like that. And so it builds into a charade, and life becomes somebody else's fulfillment. Often people wind up unhappy because they're trying to satisfy a parent that they could never satisfy as a child. So there's many, many different aspects that need to be looked at. It's at a subconscious level. It's a lot easier to say, my back hurts than my life hurts.